The words we use really matter a great deal in medicine, and I would argue in life. I think language is so important, not just to communicate your position and to understand somebody's position opposite you, but language is such a rich way to express a sentiment, a feeling, a state of mind, and to also have shared experiences. And when we use language that disconnects us from our bodies or disconnects our patients from their bodies, it can really set that person up, that patient up, for having a great deal of years where they struggle to make sense of that and to reconcile that. To give an example, if you, as a clinician, were to tell somebody that their back pain problem is because they have weakness in their core or because they don't exercise enough, and that person listening to you used to be an exerciser and can't exercise because of pain. Now they're stuck in this bind where they don't have a way out. The thing that they want to do and know might help, they cannot do because their pain is severe and they're seeking an explanation for that. So that's one particular problem that arises. And also I would say that primary care physicians or any frontline clinician who's the first portal of entry into our healthcare system, whether it's a physician or not, being mindful of how you speak to somebody about their bodies stays with that person. And they may not tell you what kind of impact it has on their beliefs about their bodies and about their abilities. And unless you ask, culturally, I don't think it's the norm that somebody will offer what they hear and state to you that it's a problem or it conflicts with what they understand, or if it worries them. So something that a clinician might think is benign is to speak about arthritis in the spine. And we all know there's plenty of research to show that what we see in medical imaging does not correlate to pain, and yet people continuously seem to cite arthritis or spinal changes as a source of pain just based on a picture. And that really does harm to people in the long term for those who have high anxiety, for those who have known pain catastrophizing thoughts. We know there's data on this, that in fact the way they think about things can be detrimental on a biochemical level. And so I think the two most important things that clinicians should be aware of, to summarize, would be the words you use really do stick with somebody, and they might not know it. And you need to check with your client, your patient, whoever's in front of you. If you're educating them about a pain problem, I would suggest they ask for that person to reflect back what they heard so they can understand the interpretation of the words they were using.